As we grow older, the body's ability to absorb and use nutrients becomes less efficient, which makes food combinations more important than many people realize. One key issue for seniors over 60 is eating blueberries together with dairy products such as milk, yogurt, or cream. Blueberries are rich in polyphenols, the natural compounds that give them their deep blue color and provide powerful antioxidant and anti-inflammatory benefits. These compounds are especially valuable for older adults because they help protect brain cells, support heart health, and slow age-related cognitive decline. However, when blueberries are consumed with dairy, much of this benefit can be reduced. Milk and other dairy foods contain proteins like casein and minerals such as calcium. These components can bind to the polyphenols found in blueberries during digestion. When this binding happens, the polyphenols become harder for the body to absorb through the gut wall and into the bloodstream. For seniors whose digestive efficiency is already lower due to reduced stomach acid and slower enzyme activity, this interference can be even more pronounced. As a result, the antioxidants that should be protecting cells from oxidative stress may pass through the body without being fully utilized. This interaction doesn't usually cause immediate harm, which is why many people are unaware of it. However, over time, regularly pairing blueberries with dairy may lead seniors to believe they are getting strong protective benefits when they are not. This can be especially concerning for older adults who eat blueberries specifically to support memory, eye health, or joint comfort. In some individuals, the combination can also lead to digestive discomfort, such as bloating, gas, or a heavy feeling in the stomach, particularly in those who are lactose sensitive or have slower digestion. Another important factor is medication use. Many seniors take supplements or prescriptions for bone health, blood pressure, or cholesterol, and these are often taken with meals. When blueberries and dairy are eaten together, the reduced absorption of blueberry antioxidants may limit their ability to counter inflammation or oxidative damage caused by aging or medication side effects. To get the most benefit, seniors are better off eating blueberries on their own or pairing them with foods that do not interfere with polyphenol absorption. Nuts, seeds, oats, or simply eating blueberries between meals can help ensure that their valuable compounds are fully absorbed. By making this small adjustment, older adults can enjoy the true protective power of blueberries without unknowingly reducing their health benefits. As adults move beyond the age of 60, maintaining stable blood sugar becomes increasingly important for energy, brain function, and long-term health. One key concern with blueberries arises when they are eaten together with refined sugar or highly processed sweet foods. On their own, blueberries are naturally low on the glycemic scale and contain fiber that slows the release of sugar into the bloodstream. This makes them a smart fruit choice for seniors. However, when blueberries are combined with foods such as sweetened cereals, pastries, syrups, flavored yogurts, or desserts, their protective effect is overwhelmed by the sudden surge of added sugars. This combination can cause a rapid rise in blood glucose levels, followed by an equally fast drop. For seniors, whose insulin response is often weaker due to aging, this roller coaster effect can lead to fatigue, dizziness, irritability, and difficulty concentrating. Over time, frequent blood sugar spikes increase inflammation in the body and place extra stress on the pancreas. This is especially risky for older adults with prediabetes or type 2 diabetes, as it can accelerate nerve damage, vision problems, and cardiovascular strain. Another important issue related to this key point is the impact on appetite and weight. High sugar combinations can trigger cravings shortly after eating, leading seniors to snack more often and consume excess calories without realizing it. This can contribute to unwanted weight gain, which further worsens blood sugar control and joint health. In addition, excess sugar can interfere with the gut microbiome, reducing beneficial bacteria that help with digestion and immune function in older adults. For seniors, the safest approach is to enjoy blueberries without added sugars or alongside foods that help stabilize blood glucose. Pairing blueberries with nuts, seeds, or whole grains provides healthy fats and fiber that slow sugar absorption. Eating them as a standalone snack or mixed into plain oats rather than sugary foods allows the body to benefit from their antioxidants without triggering harmful spikes. By being mindful of this combination, older adults can protect their energy levels, reduce inflammation, and support healthy aging while still enjoying the natural sweetness of blueberries. For seniors over 60, medication use becomes a regular part of daily life, and this makes certain food interactions more important than ever. One key concern with blueberries is how they may interact with blood, thinning medications or foods that already reduce blood clotting. Blueberries contain natural compounds such as salicylates and flavonoids that can mildly affect blood circulation. On their own, these compounds are generally safe and even beneficial, but when combined with medications commonly prescribed to older adults, the effects may become stronger than intended. Many seniors take blood thinners such as warfarin, aspirin, or other anticoagulant and antiplatelet drugs to reduce the risk of heart attack or stroke. When blueberries are consumed in large amounts or alongside other blood thinning foods like garlic supplements, ginger, turmeric, or ginkgo, the combined effect may increase the risk of easy bruising or prolonged bleeding. Aging blood vessels are more fragile, and the body's ability to quickly correct minor bleeding decreases with age, making this interaction more noticeable in older adults. Another issue is consistency. Some blood thinning medications require stable intake of certain nutrients to work properly. Sudden increases or decreases in foods rich in active plant compounds may affect how well these medications perform. Seniors who regularly eat blueberries one week and avoid them the next may unknowingly create small fluctuations that make medication management more difficult. While blueberries are not dangerous, irregular consumption patterns can add complexity to treatment plans. Digestive changes in older age also play a role. Slower metabolism and altered liver function can change how both foods and medications are processed. When blueberries are eaten too close to medication times, they may compete for absorption pathways or influence enzyme activity, making drug levels slightly less predictable. Over time, this can contribute to side effects such as light-headedness or unusual fatigue. To stay safe, seniors do not need to avoid blueberries completely. The key is moderation and timing. Eating reasonable portions of blueberries and spacing them a few hours away from medications can help reduce interaction risks. Discussing regular blueberry consumption with a healthcare provider is also wise for those on long-term blood thinners. With mindful habits, blueberries can remain a healthy part of an older adult's diet without compromising medication safety or overall well-being. As people age, the digestive system becomes more sensitive, and this makes certain food combinations harder to tolerate than they were earlier in life. One key issue for seniors over 60 is that blueberries, when eaten with heavy, processed, or poorly matched foods, can trigger digestive discomfort. While blueberries themselves are gentle and nutrient-rich, the way they are combined with other foods can place stress on an aging stomach and intestines. Reduced stomach acid, slower gut movement, and lower enzyme production all contribute to this increased sensitivity. When blueberries are eaten with large amounts of dairy, fried foods, or refined carbohydrates, digestion can slow down significantly. This delay allows sugars in blueberries to ferment in the gut, especially in seniors who already experience bloating or irregular digestion. The result may be gas, abdominal pressure, or a feeling of heaviness after meals. Many older adults mistakenly assume blueberries are the cause, when in reality, the discomfort comes from the combination rather than the fruit itself. Another contributing factor is fiber tolerance. Blueberries contain natural fiber that supports gut health, but sudden intake alongside low fiber or highly processed foods can create an imbalance. In older adults, this may lead to cramping or loose stools, particularly if hydration is low. Aging intestines also tend to have a less diverse microbiome, making them more reactive to changes in how foods are paired and digested. Digestive discomfort doesn't just affect the stomach, it can influence overall well-being. Seniors experiencing frequent bloating or acidity may eat less, skip nutritious foods, or rely more on processed options that feel easier to digest but offer fewer nutrients. Over time, this can contribute to weakness, nutrient deficiencies, and reduced immune strength. Discomfort can also interfere with sleep, which is already more fragile in later years. To avoid these issues, seniors benefit from eating blueberries in simpler, lighter combinations. Consuming them alone, between meals, or with easy-to-digest foods like oats, nuts, or seeds allows the digestive system to process them smoothly. Chewing thoroughly and eating smaller portions also helps. By respecting the needs of an aging digestive system, older adults can enjoy blueberries without discomfort and maintain better overall digestion, energy, and quality of life. As adults move into their 60s and beyond, they often become more intentional about food choices, especially when selecting fruits like blueberries for their well-known health benefits. One important issue, however, is that eating blueberries in poor combinations can create a false sense of nutrition. Many seniors believe that simply adding blueberries to any meal automatically makes it healthy, but this is not always true. When blueberries are paired with foods that block nutrient absorption or overload the body with sugar or fat, much of their protective value can be lost. Blueberries are rich in antioxidants that help fight inflammation and oxidative stress, two major contributors to aging, memory decline, and joint problems. If these antioxidants are not properly absorbed due to poor food pairing, seniors may miss out on the very benefits they are seeking. Over time, this can contribute to ongoing inflammation, slower recovery, and reduced protection against age-related conditions, even though blueberries are being consumed regularly. Another concern is that misleading food combinations can affect overall dietary balance. For example, adding blueberries to sugary desserts or processed breakfast items may lead seniors to underestimate how much refined sugar they are eating. This can quietly contribute to blood sugar instability, weight gain, and fatigue. Because the blueberries create a healthy image, these meals may be eaten more often than they should be, reinforcing habits that work against long-term health. This false sense of nutrition can also delay necessary lifestyle changes. Seniors who believe they are already eating optimally may be less likely to address other important factors such as protein intake, hydration, or fiber balance. Over time, small nutritional gaps can add up, leading to weakness, digestive issues, or reduced immunity. The body after 60 is less forgiving, and nutritional efficiency becomes just as important as food choice. To truly benefit, blueberries should be eaten in ways that support their absorption and overall meal quality. Pairing them with whole, minimally processed foods such as nuts, seeds, or whole grains helps ensure nutrients are actually used by the body. Being mindful of combinations allows seniors to turn blueberries into a genuine health asset rather than a symbol of wellness that doesn't fully deliver its promise.